Good afternoon, Michael.
Hey, Francis.
How you doing?
I'm doing okay. It's been it was kind of a shock, honestly, to get the diagnosis of the diabetes when I saw the doctor last time. So I'm just trying to wrap my head around it, I guess.
Yes. It could be a difficult thing to wrap your head around.
Yeah.
But it is a chronic condition that can be well managed.
Oh, and I guess that's the part where I need your help.
Okay.
Doctor gave me some information, and I'm just trying to translate it to what I can do.
Okay. Yeah. So put it into the practical daily
Yes.
use. So what are some of the things that the doctor would like for you to begin to think about and change?
Well, I guess the big ones were exercise,
Okay.
which is, hard for me with my walker and everything. I don't really do exercise.
Okay.
So that was one challenge.
All right. So the doctor said to increase your activity. Is that right?
Yeah.
All right.
Yeah.
So I have a couple of thoughts about increasing your activity with your walker.
Okay, that would be
Yeah.
good.
Yeah. Because you're on the third or fourth floor of your building?
Yeah, fourth floor,
All right.
exactly. Yeah.
So I think I visited you at your home and there was a fairly long hallway.
Yes.
So what about the suggestion of maybe 3 times a day leaving your apartment and maybe spending 5 minutes with you and your walker, going up and down the hall, and if you become fatigued, sitting down?
Yeah. No. I kind of feel relieved because I feel like that's something I can try, and I was worried that you guys had something else in mind.
Not running a marathon.
So yeah, right. No,
No.
running I haven't done in years.
Right. Who has?
But walking down the hall I could do.
Okay.
Yeah.
All right. So do you think that is something that you could incorporate into your routine maybe 2 to 3 days a week?
I will try. My apartment's right there at the elevator, so
Yes.
I'm not doing a lot of walking now.
Okay.
And I will try that for sure.
Okay.
Yes.
All right. And what was the other thing?
Well, also kind of is, I guess, with my diet, what I eat, and I'm got kind of my fixed routine,
Okay.
and I guess it's all bad for me.
Well, it might not be all bad. What is your routine?
Well, basically, I go to there's the Wendy's right on my block. I go there too much. You probably think that's I was gonna lie. I'm there pretty much every day.
Okay.
It's really what it is.
All right. So what that means is you know their menu options and choices fairly well. That could be a good thing, right? So sometimes it's about switching things, right? So, like if you enjoy their meals, maybe switching to a kid's meal, which includes fruit rather than fries. And if you stay with the adult meal, whether it's for breakfast, lunch, or dinner, you could choose to leave the buns off and maybe choose fruit as opposed to the fries.
The bread part's
The
not so
bread
good.
part.
Yeah.
Yeah. I mean, it's you don't have to go all or nothing.
Yeah.
Right. So you could maybe eat one portion of the bun like a pizza. Right.
Okay, like just change it up a little bit.
Yes,
Is
yes,
is kind of
yes.
what I'm hearing.
And what about beverages?
Pepsi, not Coke.
Okay.
Basically,
Right.
you know.
Right. So what about the Pepsi? What is it about the Pepsi that you like?
That's an old thing for me.
Okay.
Like, maybe that's why I have the diabetes, like 40 years.
Okay.
So it's familiar, and I like the taste, and I like the carbonation, the bubble thing.
Okay.
So it's just kind of like, since I quit smoking, it's kind of like a comfort thing.
Yes. Would you be willing to try it on at least once or twice a week, right? at first to see what you think, because there are a number of options. You said you like the carbonation, the
Yes,
bubbles.
yes.
So would it be possible to switch out the cola for like a seltzer water or a tonic water, right? They have a little taste to them.
I guess they have that there?
Yes,
Yeah,
they do.
Okay,
It's a part of their choices, a part of their healthier choices.
okay.
And then they always have lemons or limes sitting next there.
Yep.
Try that. Squeeze the lemon in there, drop the lime in there, and see, how that strikes your taste buds.
Yeah.
It could be a really cleansing thing, because then you'll begin to maybe taste flavors a little bit more intensely.
Yeah, no, I mean, I can feel like the resistance, but I understand what you're saying, and I will try that too, and I realize, I just the doctor was saying that this could be pretty, I already have problems with my feet, that this could be bad, so, and honestly, I thought you were gonna tell me never to drink a Pepsi again, so.
No, that doesn't help.
I can try that. I will try that.
Okay,
Yeah.
all right.
I will
And
try
what
that.
about your feet?
Well, they hurt a lot, and he said that I can't remember the word he used, but he said that it could be that they don't know how long I've had the diabetes, so it could be that part of it is
Okay.
what's happening.
All right,
It is
all right.
the pain could be
Okay.
from
The neuropathy?
the neuropathy. Yes.
Yeah, okay.
Yeah.
So what might be important too, because your doctor has already listed it down as a chronic condition, is for you to visit a podiatrist, which is a simple e-referral where they would help you with kind of like shoes that would be the most appropriate for your condition. And then it will also lessen some of the pain that
Is
you
that
might.
a shoe store? What's the
Not a shoe store, a podiatrist. He's he's in your clinic. So basically, a visit with him, he'll thoroughly examine your feet, and then
Okay.
also write a prescription for some shoes.
So it's like I wouldn't even have to pay for the shoes.
No,
then.
it's a
Could-
part of.
Oh, I see.
It's a part of your
Okay.
health coverage benefit.
All right, yeah, no, if you can help me with that,
Oh, yeah.
that would be good, because that, I think, also for the walking.
Yes.
If I'm standing too long, that hurts. Yeah, okay,
Yeah.
that sounds good.
Is there anything else?
I feel like that's probably enough almost for me to
Okay.
start.
Okay, I know it's a
Because,
lot, right?
but it's helpful,
Okay.
yeah.
So, just gonna recap. So you're gonna consider switching out the fries for fruit.
Yes,
You're going to consider switching out one bun or two
Yeah.
for the meal.
yes,
You're going to consider using a carbonated club soda, tonic water, maybe dropping some lemon or lime in.
I think I'm gonna just take a look at that healthy choice menu that
Okay.
I just never even looked at
Okay.
it. And so I will do those things and see what else I could try.
Okay.
Yeah,
Would you consider also doing a food journal, food and beverage journal?
what's that?
Basically, you can have a couple of choices of either taking a photo of everything or most things that you consume, and then, or write things down. And then on your next visit, we could talk about some of the successes.
No, yeah, I will try that for
Okay.
sure. You might have to remind me,
Never mind.
but but I will do that.
Okay.
And then you can help me figure out if I'm heading in the right direction.
Yes, yes.
Okay.
All
Yeah.
right. So Michael, just to recap, you agreed to use your walker, your seated walker, and travel up and down your hallway at least 2 to 3 times a week for at least 15 minutes?
Yeah, I will.
Okay.
I will definitely start to do that, and I think that the person that's going to help me get the shoe, that's that will help that
Yes.
go together.
Yes.
Yeah, no, I want to get this better under control, because
Okay.
it made me worried what the
Yeah.
doctor said.
Yeah. Diabetes is easily managed. Increasing your activity, changing some behaviors,